am dubious about marijuana. States, can pass whatever laws they choose, but I'm not sure we're going to be a better, healthier nation that if we have marijuana being sold at every corner grocery store.
Hey, man. What? What's in this shit, man? Mostly Maui Wowie, man. Yeah?
These high school boys and girls are having a hop at the local soda fountain. Innocently, they dance. Innocent of a new and deadly menace lurking behind closed doors. Marijuana, the burning weed with its roots in hell.
You are listening to the Medical Podcast, a podcast publication, part of the Pharmacy Podcast Network. The Medical Podcast is dedicated to pharmacists, healthcare professionals, and is devoted to delivering accurate, timely, cutting-edge information about medical marijuana. We will bring you the most up-to-date scientific, political, regulatory, financial, and interesting information not available on any other podcast program. Not since Silicon Valley and the technology boom have we seen the likes of any other industry that has grown this fast over a relatively short period of time. The medical marijuana industry is projected to hit the $30 billion mark in the next 5 years. The medical cannabis industry has the potential of helping billions of people around the globe, but at a significant social, economical, and political cost. Our goal is to answer some of your questions, plus heighten, enlighten, confuse, and frustrate you all at the same time. So fasten your seatbelts, keep your eyes on the road, and get ready for some fun. And now, here's your host, registered pharmacist, life student, and medical cannabis professional, Joseph Friedman.
Hey, this is Joseph Friedman, pharmacist with Canna RPh consulting firm and PDI Medical Dispensary in Illinois. And welcome to the Medical Podcast Show.
Hey, Pharmacy Podcast listeners, this is the Pharmacy Podcast Network bringing you the very first episode of the Medical Podcast. I couldn't be more excited about this show because I, for one, am constantly perusing and searching the old Google sphere for the best information out there to reference and send to pharmacists, send to consultants, people in the industry about medical marijuana, medical cannabis. And we've had on our show, on the Pharmacy Podcast, over 4 times, Mr. Joseph Friedman on the show as a guest, as a subject matter expert. We're excited about Joseph helping us to lead this new podcast, and we're welcoming him to his own show today. Joseph, are you out there?
I am here, and one of the things that I think could be a little confusing is when you say podcast, it's PODCAST. This is the Medical POTCAST show. So that's a pretty important distinction.
That's right. This is the Medical Podcast. So play on words, and nobody had the domain, so I figured we'd take it to make it easier to be found, and it'll be very linkable from the Pharmacy Podcast Network. But I'm excited, Joe. You've been around for quite some time as a leader in delivering good information, as well as some things that you've discovered on your own research. I've been following you for about 3 or 4 years now. I'm excited that we're doing this show because if we could just give our listeners, the pharmacy profession, a good resource, a good audio blog, and then taking those questions that come up through Twitter and LinkedIn and Facebook and be able to push them back into an audio blog and audio show, I just think this is going to be a good source of information.
Right, and I think the idea of getting this good information out to pharmacists is extremely important. Knowledge is power here, but I think we're also going to attract other healthcare professionals. What do you think, Todd?
I think you're absolutely correct. And just for our listeners who might not have heard of Joseph Friedman, tell us a little bit about yourself, your background, and why is it that you're excited about the Medical Podcast?
Thanks, Todd. Well, I am a registered pharmacist. I was practicing pharmacy for many, many years, a lot in the corporate world. And so I also picked up a business degree. And then about 5 years ago, I started thinking, okay, this could be a pretty cool industry to get into. I knew Illinois was going through the process of bringing medical cannabis into law. And so I took the plunge, and I was successful getting a license and opening up a dispensary. But I didn't stop just there. I think what we're doing is getting, probably the most professional dispensary in the state of Illinois. I've got pharmacists and nurses on board. No other dispensary in Illinois really has the expertise that we have, and we are seeing that by the patients that are actually switching from other dispensaries after some time and going, you know what, they're really nice guys, they're beautiful dispensaries, but they're not healthcare professionals, and this is what we're about. And so opening up this dispensary was one thing, and taking it to the next step and getting out there and giving presentations to pharmacy groups and associations has been just wonderful. One of the things that happens, Todd, in these presentations, and I learned early on, that you have to leave enough time for the Q&A session, because there's never enough. And so it's just a hot topic, and there's a groundswell of interest on medical cannabis, and I've got some stories that will actually bring that to light.
As a pharmacist, Joe, what ingredient is the ingredient in most cough syrups that gets you high? It's pronounced like dextrometamorphophran or something like that. I can't say it.
Dextromethorphan.
Yes. Okay. So herein lies an example, and just tell me if I keep telling my friends and family something wrong. So when we discuss medical marijuana around the supper table, or I'm out with some friends and stuff, I always say, hey, would you go out and buy a whole bunch of cough syrup to drink it and get high? And they all look at me with a smirk on their face, and the answer is always no. And I said, okay, medical marijuana, from my perspective, is the exact same thing. It should be used as medicine, and it should be used as medicine in the hands of a healthcare professional who understands exactly what it does from a clinical perspective and how it interacts with other medications. And I don't see it any different than any other medication that a pharmacist would consult on, other than not understanding it specifically, just because there's not enough education out there. So do you think that's like a good table setter for friends and family?
Yeah, that's an excellent table setter. And you know what? I'll use an example just to kind of drive home the point that we really need to educate healthcare professionals and pharmacists. I recently had a patient, actually the father of a patient. The patient has severe seizure disorder. The patient was going to be admitted into the hospital for testing. So what they needed to do was induce seizures so they can identify the parts of the brain that are affected. He was well controlled on medical cannabis, and so the father said to the hospital administrator, well, you know what, I really want him to be on medical cannabis in the hospitals until the time that you need to induce seizures, and we'll take him off. And the hospital administrator said, well, you know what, talk to our pharmacy department here in the hospital, because they've got, marijuana in there. And so the father, he scratched his head and said, okay. And, he kind of doubted that, but he called the pharmacy department and talked to the pharmacist and said, oh, yeah, we've got Marinol. And so the father said, well, my son's on, a combination of THC and CBD, which is really controlling his seizures. And the pharmacist on the other end of the phone said, what's CBD? So, when I heard that story, I go, wow, we've got some work to do here.
Red flags, right?
Exactly.
So what's the first level? So I like peeling back the onion of mystery. I'm a pharmacist. I'm on my way to work. I'm listening to the show, interested in listening to this new, what is this medical podcast? Let's set the stage. What's the high level? What are we trying to accomplish here with this monthly publication?
Well, the plan, and this is what my vision is we're going to be interviewing world leaders and experts on medical cannabis who are in healthcare. So it's not just going to be people going, yeah, I got a pot shop and I'm making a lot of money. It's going to be people that are behind the science and the clinical application of medical cannabis. So that's one thing. I want to interview these people. The second thing for pharmacists that are driving into work right now is this is going to be a very interesting 20 minutes, 30 minutes, where you're going to hear up-to-the-date information on what's happening at the state level, your state, my state, every state. At the federal level, there's always, interesting things happening there. And then, so we're going to cover the political side of this thing, the clinical side of this thing, and also the potential for you getting into the business. I've got a consulting company called Canna RPh, and that's Canna, C-A-N-N-A, RPh. I'm working with another pharmacist, and we have successfully consulted with other groups around the country already. And I love the idea of consulting with pharmacists who have interest in getting into this, because as a pharmacist, you've got credibility. And when you get in front of your local community managers, that's going to go a long way. In fact, I met with a local community manager just this afternoon, and he just was thrilled with everything that we're doing in our town of Buffalo Grove and helping the community and helping the patients.
So is there currently a continuing education course or something as a pharmacist that I can take to get more education on medical marijuana? And if not, is that something that your consultancy would kind of guide us towards in getting good information to pharmacists?
Absolutely. And in fact, one of the things that we do in my dispensary, and this ties to your question, Todd, is I've got relationships with 3 different colleges of pharmacy. And so we're the first dispensary in the nation to have clinical 4th-year pharmacy students doing clinical rotations. And so when these students come on board, or before they come on board, I send them an email, and that email contains several links so they can get acclimated to the idea of medical cannabis, where it relates to disease conditions and those symptoms. And then as well as different links for, very good sources. So, and I'm happy to share that with any listener.
Everything that we talk about today, any of the links, any of the URLs that we can put in the show notes, they'll be down there, as well as your latest podcast that we did on April 20th, which was the last time you were on the show. So, if you have questions for Joseph Friedman, please reach out to him as well. By the way, we've set up an email address just for this show questions called medicalpodcast@gmail.com. That's medical, POTCAST @gmail.com. That will also be in the show notes. The reason being is we want to make sure that we're responding quickly, and this email address will flow to specific other email addresses to ensure that we get questions answered. But Joseph, I tell you what, there's so much to learn, and it just seems like, there's just as much bad information out there as there is good information out there. What's the state of the nation update on medical marijuana from the country's perspective? That is the nation.
Well, when we think about that, most of us are focusing in on, okay, what's Jeff Sessions, our Attorney General, up to, and what's he going to do as far as trying to bring this industry down? And just this past week, he held a closed-door meeting about drug policy with several longtime opponents of marijuana legalization. So think about that. He got into a room with people that are with, let's see, Bertha Madras, Dr. Hoover, Edgar. I mean, all these, I wish I had their designations. I think they're with Sloan Kettering and various governmental agencies. But, he was in a room with all these people that were also against, and they use the term marijuana, okay? I use the term cannabis because marijuana, I think, is a slang term. So when Jeff Sessions gets up there and starts talking, he talks marijuana, and he was in a room full of marijuana haters. And I think the plan that Jeff Sessions has is to build up a case to crack down on this industry on a national basis. Now, there's going to be a lot of opposition to that. I don't think one man and one agency is going to be able to accomplish that. This industry is too big. The train's left the station. But there's always something going on, and there's always these challenges. We just have to pay attention so we're not caught blindsided.
So I think education is a big part of this. It's exciting that I have a network of policymakers throughout the country that I've been in touch with over the last 8 to 10 years. So I'll make sure that some of them are also on the medical podcast distribution list. I think it's a great way to absorb information as you're on your way to work, you're jogging, you're doing something that you just want to listen to, a show that's about the healthcare profession, specifically pharmacy. So, having that monthly show accessible and giving you the latest updates, as well as the consultancy that Joseph does with his team, I think is tremendous. And I think that I've seen other podcasters step outside of their day jobs and do side hustles that involve consultancy, involve medication therapy management. One of our previous co-hosts launched an entire educational online platform. That was Blair Thielemeyer. She actually is retiring from the Pharmacy Podcast Network, but will continue to kind of link up with other pharmacist podcasters that we have. So this is really dedicated to the pharmacy professional. But if you're a nurse, if you're a physician, you're listening to the show and you have questions, make sure you reach out to us, medicalpodcast@gmail.com. And I tell you, I've read just today, something was published that the news said Jeff Sessions isn't giving up on weed. He's doubling down. Congressional dysfunction may do what pot-hating Attorney General hasn't managed to do all year, remove protections for the booming legal weed industry. And it's frustrating. I feel like we take one step forward and 3 steps back with this guy who refuses to see the clinical side to it all, and he throws it all in the same bucket. And that to me is pretty frustrating, Joe.
Right. But Senator Blumenauer, let's see, out of Oregon, he's also in that same article, Todd, and he just said there's going to be a ferocious backlash if Sessions tries to do a crackdown on this industry. It's just that this train has left the station. I said that before, and you've got one guy who has an obsession with bringing this industry down. Hopefully the investigation into his ties to Russia are going to bring him down, and so we're not going to have to deal with this any longer going into the future.
So I'm listening to the show. I'm a pharmacist. I'm working in, let's say, senior care. Let's start picking some of these places where medical cannabis has been leveraged to really help out. One of the most fascinating sections of what is medical cannabis is the compounding side. Our buddies over at the Pharmacy Inspection Podcast, Dr. Seth and Dr. Brian, actually have joined the Pharmacy Podcast Network. And they're going to be doing some podcast continuous. I think they do twice a month and sometimes 3 times a month on compounding. And compounding to me seems really attractive to the whole medical cannabis sector and industry. I think of my grandmother. My grandmother suffers with arthritis and with pain. She lives in Butler, Pennsylvania. And obviously she doesn't have a medical cannabis salve or cream or something that she can place on her elbow and her knees. But Joe, that's like one of the first things I think of is how the compounding sector of pharmacy is going to be able to mix this into a Bengay-like topical and then rub that into your muscle and have that really do the magic that it could do. Talk to us about like senior care and medical cannabis.
Sure. And then, on the compounding side, and, I was recently, I gave a presentation at NCPA where I saw you, Todd. And, I was talking to an individual I used to work with in one of my former jobs. And he's with Letco. Letco is the manufacturer of a lot of the creams and the bases that are used in compounding pharmacy. And his thought is that, once cannabis gets rescheduled from one to something other than one, the first place where it could go is into compounding pharmacies, where you'll get in this Schedule 2 or Schedule 3 product, and you'll make pharmaceutically elegant compounds that on all the different routes of administration. So that's one way to go. Another way it can go is it gets rescheduled, and Walgreens buys up some of the premier growers in the country, and they just create their own brand of cannabis to be sold out of their own pharmacies. I wonder what the pharmacy listener thinks about that. But from the standpoint of its use in nursing homes and senior facilities, I actually have something coming up just this Thursday where I'm going to be in Northbrook, Illinois, at a place called North Shore Place. And I got the permission to go ahead and form a strategic alliance with this facility. They've got 140 beds, 40 memory deficit beds. And I'm going to be in front of these patients and their family members, and I'm going to talk about the benefits of medical cannabis. Now, we don't want people in nursing homes just toking up, so we've got all kinds of different routes of administration, tinctures, oils, patches, edibles that I'm going to talk about, answer questions, and we're going to get these nursing home patients on board, the ones that can really benefit from this.
Makes a lot of sense. I mean, we could talk about pediatrics, we could talk about senior care, we could talk about cancer. I'm excited about the medical podcast and being able to deliver a good show, a good usable source of information, and bring our pharmacists up to date. I know the Letco guys too. I know Mr. Eric Tosh. I'm not sure if that's the guy that you were talking about with Letco Medical, but what a group of great guys, and they're dedicated to the pharmacy profession too.
Right. And, I think the idea here is, if you're a pharmacist, this is coming your way. This is a medicine, back in the 70s or the 80s, when we started, when AIDS was really becoming something that everyone was hearing about, Glaxo and some other Merck, came up with these cocktails. And, it was the first drug therapy to combat this exploding kind of disease. And pharmacists had to be quick studies. So I think we're at that state again where pharmacists need to be quick studies on medical cannabis. In fact, the pharmacist letter now has a module on medical cannabis. I edited it and helped the pharmacist letter publish that, and it's available, and it's a CE.
That's great. That's probably another link we should have down in the show notes too, just in case. But if people want to reach out to your organization just to get that consultancy insight, I think that's also very attractive.
Right. And then, having, I'm chained to my dispensary, PDI Medical in Buffalo Grove, Illinois. And so I see day after day after day just the miracle that this medication represents. And, and it's not just someone coming in like they do in other dispensaries and here's the menu, tell us what you want, or this stuff's really good for pain. We sit down with these patients, we go through an intake form, we understand their medications, we look for drug interactions, with cannabis, also with the medications that they're currently on. I've caught several of them. Sometimes they're not feeling well, and it's really due to a drug interaction they're experiencing. And so these consultations can take anywhere from half an hour to 2 hours. I've got a pharmacy student right now who's working on trying to figure out how we can bill insurance companies for medication therapy management. That's going to be a little bit tough to do, but these pharmacy students coming in, they're assigned projects, and this is one of the more interesting ones that I think will be historical if we can actually start billing insurance companies for these 2-hour consultations.
Yeah, I would think if a patient is on more than, I forget what the number, if it's 2 or if it's 3 medications, it would be a candidate for a medication therapy management review because of that polypharmacy situation. But yes, I most definitely see high blood pressure and hypertension and some cancer medications. And other things that are taking place to cross-reference medical cannabis as part of that medication therapy management. So have you done any or have heard of any pharmacists actually doing MTM and including medical cannabis as one of the medications that's being reviewed?
No one's done that yet. And as my pharmacy student has dug into this, it's going to be a little bit dicey and complicated. I think I need to have a DEA license in my dispensary, which I can't get. But I know there's going to be some hurdles, and I'm going to try to approach those hurdles and hopefully jump over them and get something going. But right now, Todd, I'm not aware of any MTM with cannabis that's going on.
If you're listening to the show and you've heard of any medication therapy management reviews happening, any MTMs with pharmacists out there, please reach out to the show, medicalpodcast@gmail.com, or we're on Twitter, Medical Podcast. There's lots of ways to get in touch with us, or even the pharmacypodcast.com contact section of the website. Joseph, what else do you have planned for Medical Podcast?
Well, one of the things that we're involved in, and this happened a couple of weeks ago, it made a big splash in Indiana, was having a Republican representative come and tour our dispensary, who is in the process of submitting legislation to have a full-blown medical cannabis program in Indiana. And what was beautiful about that is, he came in, he did a tour of our dispensary, he did a tour of a cultivation center. He put together a lot of information which turned into the legislation that he submitted, and it's in session right now. And he got special permission from our state regulators to come and tour our entire dispensary. Now, this hasn't happened before. Usually, politicians are limited to just going into the retail area. They can't see behind the curtain, if you will. But he was able to see everything in the dispensary, including our vaults and our generators and behind the back offices. So he really got, quite a lot of good information. And the state regulator actually asked him when the plans were being made, hey, we've got other dispensaries in Illinois. We've got, in fact, 52 other ones. Why don't you stop by and visit some of the others? And this representative said, no, I want, PDI Medical to be the model for Indiana's program. So I'm very humbled by that.
That's incredible. Congratulations.
Thank you.
It's a great reference. Who are the leading sources of research for medical cannabis right now, and even schools of medicine that are involved in those? You had mentioned a couple in the state of Illinois.
Leading researchers in schools of medicine. That's a great question. I think, we're lacking in this country. Todd, were you referencing anything in particular? Because I think you've got to go to Israel, and you've got to go to Spain, and you've got to go to other countries.
No, just fishing for ideas and or names for reference, because I've seen research coming in from other parts of the world as well, and I wondered who was the leading researcher from a university perspective in the United States.
Good question. I'll have to research that.
Yeah, there's an article that came out of Business Wire that says FCM Global launches medical cannabis research and development lab in Colombia, and that is not Colombia, United States. That's Colombia, the country. So it's interesting. I'm wondering what university is leading in this. I know that I've heard of Penn State University in the great state of Pennsylvania, or actually Commonwealth of Pennsylvania, doing something with research, but I still don't know at what level it is.
Well, yeah, the program in Pennsylvania is still, it hasn't started yet, but there are some dispensary and growing processing license applicants who have a lot of great intentions of working with Penn State and other universities to do research, but that has not started yet. But if you look at Israel, you look at Raphael Mashula, who really is the father of, medical marijuana or cannabis. He identified THC and has gotten a lot of accolades for being the first person to really uncover, or like you say, peel back the onion to understand this plant.
Yeah, article out of USA Today that was posted on December 18th. First medical marijuana farm comes to the big state, and it's all based on growers in the state of Ohio, in Cincinnati, as a huge grower of medical marijuana that was coming up. And I believe it's called Cresco Labs that was posted in that. $7 million, 50,000 square foot state-of-the-art greenhouse on 8 acres of land between Dayton and Columbus. So that's pretty exciting.
And you mentioned the name Cresco Labs. They're based out of Chicago or based out of Illinois.
Yes, they are.
And that was the cultivation center that the representative from Indiana toured. I made those arrangements, and Cresco Labs is perhaps the most professional grower that we have in the state of Illinois. You would not believe. I mean, it's like going through a pharmaceutical manufacturer with all the equipment that they have there and the products they produce.
Well, Joe, I'm excited about the show. I just want to thank you on behalf of the Pharmacy Podcast Network for taking the lead on this. We want to bring, like I said, great knowledge and information to the pharmacists that listen to the show and other healthcare professionals. Once again, if you have questions, please reach out to the show at medicalpodcast@gmail.com, or you can send an email through the pharmacypodcast.com contact section. Also in our contact section, there's a place that you can record a question. If the question is about medical marijuana, medical cannabis, we will insert that question into the next show, and you'll be featured on the show that Joe and I can take time to answer your question. Joe, in closing, anything that you'd like to tell our pharmacist associates, and healthcare professionals?
Sure. You know what? If in your particular state, there is an opportunity, if the program is not currently there, I am happy to come out, give a presentation, make the case at the state level. I've been able to get a lot of things going with various organizations at the state level where there was some form of resistance. In fact, there's I'm going to a rally in Indiana January 3rd, 2018, and I'll be speaking out on behalf of the benefits of medical cannabis as opposed to the wrath of marijuana from reefer madness. So I think the idea is, if you have any questions, I think this is a great venue for voicing those questions, and the idea of reaching out and getting some things started at your own state level, and involving people that are knowledgeable about this, myself, Todd, and then the Canna RPh, our consultant company, certainly very interested in helping out any way we can.
And I thank you for that, Joe. Very much appreciate your lead on the Medical Podcast. And that's a wrap for our very first show of the Medical Podcast, part of the Pharmacy Podcast Network. If you have questions, please reach out to us. It's at Twitter, at Medical Podcast, or Gmail, medicalpodcast@gmail.com. Joseph, we will talk to you next time.
Thanks, Todd. Happy holidays.
Thanks for listening to the Medical Podcast, part of the Pharmacy Podcast Network. If you enjoyed this podcast episode, please help us by sharing the show on your LinkedIn, Twitter, and other social media networks. If you have healthcare-oriented questions, or are a pharmacist or healthcare professional and want to learn more about medical cannabis, please reach out to our team by email. Send your message to medicalpodcast@gmail.com. The Medical Podcast should not be used in any legal capacity whatsoever, including but not limited to establishing standard of care or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast. Seek all medical advice and/or treatment from a certified, registered, licensed physician and/or pharmacist. This is not legal advice. Seek out a knowledgeable lawyer about the subject. The Medical Podcast is for general information purposes to generate meaningful conversations about medical marijuana and is not an authority on the subject from a clinical or legal perspective.